Another foundational concept in health promotion is the concept of health inequities, and how it's easier for some people to be healthier than others, and some of the reasons for why that is. So the readings, and in particular the video that I've posted as part of this unit, is really going to give you some more specifics and some good insights in what I mean by health inequities and how they really disadvantage certain people. So according to the WHO, there are certain prerequisites for health, some kind of basic things that we need in order to be healthy. Before we can even think about exercising or eating a healthy diet, we need peace, shelter, education, food, income, stable ecosystem, and we need social justice and equity. They recognize how important that is. And that's something you're going to come up against as a health promoter, is that it's easier to promote health in certain populations than others because certain populations are disadvantaged, and they're disadvantaged for a whole slew of different reasons, some more than others. So we're going to explore that in this unit. So what I mean by equity as opposed to equality, and these terms are sometimes used interchangeably, but they're not really the same thing. Equality means that everyone's equal. And quite honestly, we're not equal. We're, some of us are stronger than others, or there's physical differences, but there's also economic differences. There's also differences in where we were born. I feel very blessed to have been born in Canada. I have so many more opportunities than had I been born where my father was born, which is in Argentina, or had I been born where my mother was born, which is in Colombia. I wouldn't have the same opportunities for health and well-being there as I do here. So equality really is, let's give everyone the same thing, let's treat everyone the same, and that's fair, okay? But equity takes into account that we're not all starting at the same place. And if we treat everyone the same way, certain people are going to be disadvantaged. So equity is about creating the right supports so everyone has the same chance at a good life, at health. That's what equity is about, okay? And I love this diagram as well because it's kind of the same concept, and it talks about here we have equality. So remember, this person that's disadvantaged can't see it all. Okay, here we have equity, one level of equity, where we create the right support so everyone has the same opportunity. And kind of that next level equity is taking down those barriers that affect everyone. And this is a hard one to do. How do you actually address the systemic problems or the systemic issues that disadvantage some more than others to begin with? Not just helping disadvantaged people, but eliminating even the opportunity to be disadvantaged in the first place. That's very hard to do, but again, this is something that public policy and having a political influence could make more of a difference in. So I want to get a little bit more specific about how inequitable certain things are, both in the United States and in Canada. So this is a couple years old, but this chart highlights the percent knowing a friend or family member who died because they couldn't pay for medical care. Now, obviously, the situation is a bit different in Canada because we have universal health care, but in the States, not having good health care is actually a matter of life and death sometimes. So you'll notice that the amount of white people identified as white who said that they know someone that died because they didn't have good access to healthcare was 10%. It was double in non-white populations. Those people that were poorer compared to those that had more money, they were again twice as likely to know someone who had died of not because they couldn't pay for healthcare. Okay, another example is that certain age groups are more likely to not have the money or know people that don't have the money to pay for medical services in the States, okay? So it shows again how race, how age, how income level, how these can all affect health and life in this case as well. So a more local example can be seen in the Indigenous population here in Canada. So if we look at our three major Indigenous groups, the Inuit, the Métis, and the First Nations, compared to non-Aboriginals, we see that there are much higher rates, especially in Inuit communities and First Nations communities, of living in crowded dwellings. And this could be for economic reasons, this could be for geographic reasons as well, or other things that disadvantage these communities. People that are living in dwellings that are in need of major repair, again, we see much higher rates within Indigenous communities compared to the rest of Canada. And this is especially relevant right now in the time of COVID, because if you live in a crowded dwelling, there's a higher likelihood that certain infectious diseases will spread, right? So it really is an unequitable situation where that affects their access to good health. Here's another example of health inequity within Indigenous populations here in Canada. And in this one, actually, we contrast both income level and Aboriginal or non-Aboriginal status. So you'll notice at every income level, there are higher amounts of poor health in Aboriginal communities compared to non-Aboriginal communities. And again, that poor health is higher when the income level is lower, both in, again, non-Aboriginal communities and Aboriginal communities. So again, showing that culture and ethnicity as well as income are things that create an unequitable and an unequal access to health and capacity for health among certain communities. So in the readings and in the videos part of this unit, we're going to explore this concept a little bit more. In particular, I really want you to pay attention to that video from that doctor in the States who talks about some of the health disparities that are seen in communities, in Black communities in the United States with respect to COVID. So take a look at that video because it really highlights how inequities really affect the health of a population. And as health promoters, one of our tasks is to try to narrow those inequities, to make them as minimal or ideally eliminate them. But again, that often requires a lot of social capital, and it requires a lot of political capital too. And it requires time. But we have to be aware of these inequities when we are trying to make a difference in the health of a population or into another person as well.